Okay, today's lesson is sinus arrhythmia. Sinus arrhythmia, including sinus tachycardia and sinus bradycardia. That means there is abnormal arrhythmia which comes from the sinus node. So we call it a sinus arrhythmia. So about the sinus tachycardia, it defined as heart rate faster than 100 beats per minute. And sinus tachycardia usually occurs with fear, exercise, emotion, anemia, heart failure, shock, inflammation, and hypotension. And sometimes it responds to many drugs. So this is an ECG of sinus tachycardia. And this ECG, you can find that there is a normal P wave here. The P wave is normal. That means it comes from the sinus node. And the P wave morphology is opposite, right? So the heart rate is faster than 100 beats per minute. So what about normal P wave? It is very important for us to define whether the P wave is come from the sinus node or not. So in this picture, it shows that if the P wave in at V1 is upright, and at AVR is inverted, and of course at lead2, lead3, and AVF, the direction of P wave is upright. So it means the P wave comes from the sinus node. So this is the morphology of the normal P wave. What we'll do if the ECG shows sinus tachycardia? Firstly, it should be focused on the cause of the tachycardia. For example, if the patient has a fever, we should use some drugs to decrease the fever. Or if the patient has anemia, we should treat the anemia first, including heart failure, inflammation, and hypertension. That means that we should treat the cause of the tachycardia first. So we cannot use the drug to decrease the heart rate only and forget to treat the cause of the tachycardia. And after that, after we use some treatment to treat the cause of the tachycardia, we can also use some drugs to slow down the heart rate. Beta receptor blockers and calcium channel blockers can be used for the sinus tachycardia directly. Okay, the sinus bradycardia, it means heart rate which is slower than 60 beats per minute due to the increased vagal influence or organic disease of the sinus node. And in healthy individuals, especially in athletes who are in excellent physical condition, their heart rate usually range at the 45 to 59 beats per minute. That means that the patient has a sinus bradycardia, but I cannot say this patient has a disease because for these individuals, for these patients, their heart rate is usually slower than normal people. So this is an ECG of sinus bradycardia. In this ECG, we can find is a normal morphology of a P wave. Because a P wave at least is upward, right? Maybe it is at least 2 or something. But the heart rate is slower than 60 beats per minute. So we can diagnose this ECG as a sinus bradycardia. There are many reasons that can cause the sinus bradycardia. Frequently occurs in young adults and sometimes at well-trained athletes. Sometimes the sinus bradycardia increase with hypothermia or vagal stimulation. Sometimes severe sinus bradycardia may be an indication of sinus node pathology, such as sick sinus syndrome. We mentioned it before. This is something that can destroy the function of the sinus node. So the electrical activities of the sinus node is completely destroyed or something. So the heart rate is slowed down quickly. And sometimes in elderly patients, they usually had the sinus bradycardia too. And for sinus bradycardia, it may cause weakness, confusion, and even syncope. If the cerebral perfusion is impaired. Treatment of this sinus bradycardia is also important. The atropine or isopranoline may be effective for the low cardiac output. Sometimes electrical pacing is the best treatment for the symptomatic sinus bradycardia. That means that if a patient has sinus bradycardia and with the clinical manifestations of syncope or something, we should use the electrical pacing for this patient because this treatment is the best choice. This is a picture of electrical pacing. In this picture, you can see this is a pacemaker. Right? It's a pulse. It can generate the pulse. Electrical manual activities. So the electrical activities come from this lead, which can be placed at the apex of the right ventricle. It can produce electrical activities. We call it electrical pacing. And it's only one lead. So we call it a single chamber pacemaker. And this pacemaker is a little bit different because it has 2 leads. One lead is usually placed at the apex of the right ventricle, and the another lead is usually placed at the right atrial appendage. We call it a double chamber pacemaker. Okay, sinus pause means that there is no P wave for a long period of time, and the PP interval surrounding the absent P wave is not a multiple of the P uh, to P interval. So how can we interpret this statement? This is the ECG of sinus pulse. What we can see here is a normal morphology of P wave here, right? It's a P wave at lead 2. P wave is upright. Yes, the P waves come from the sinus node. It's 1 bit, 2 bit, 3rd bit, 4th bit. Yes, many bits here. But what happens? There is no QS complex at all. There's a long period of R intervals without any P wave here. And here is also a long R interval here. And about this wave, before the QS complex, there is a P wave here, right? Yes, it comes from the sinus node. What about this wave? This wave, and also this one, this one. There are no P wave at all, right? So what is it? Does the QS complex come from? Does it come from the sinus node? Is it right? Of course not. It's not from the sinus node, right? If the QS complex, or if the potential is come from the sinus node, it should be have a sinus P wave. Like this one, right? A sinus P wave because it has a sinus P wave at the front of the QS complex. But for this QS complex, it does not come from the sinus node. It comes from the junctional area. You remember that? Yes. We mentioned that there is no P wave here, right? Only a QS complex. So the potential is come from the junctional. We call it a junctional rhythm, right? Okay, it's a junctional rhythm, and it's a P wave. Okay, so at the middle of this one, there is a long sinus pulse here. So this patient should be diagnosed as sick sinus syndrome, right? So there are many reasons that can cause the sinus pulse. First, excessive vagal tone or correctile sinus oversensitive. And second, and also most important, is sick sinus syndrome. And sometimes the acute myocardial infarction can cause sinus pulse. And sometimes degenerative fibrotic trait and digitalis toxicity also cause sinus pulse. But the most important reason, I think, should be sick sinus syndrome. What about the clinical manifestation? It has sinus pulse, syncope, and pre-syncope. So what should we do if the patient has a sinus pulse? Firstly, we should find the cause of the sinus pulse. So the etiological therapy is really important. If the patient has a toxicity, or if the patient has a acute myocardial infarction, we should treat the cause first, right? Otherwise, the drug therapy is not so effective as what we expected. And the second treatment for the sinus pulse is the way of increasing rate. We can use drug. We can use the some drug that can activate the automaticity of the sinus node, so that the heart rate can be accelerated a little bit. And the last one, and also the most important one, is the electrical pacing. Yes, we mentioned it just a minute ago. Electrical pacing is really important for the clinical doctors. And most of the time we use the two-chamber pacemakers because it's more physical for the patient. And we then focus on the sick sinus syndrome. The patient with the sick sinus syndrome usually shows sinus arrest, sinoatrial exit block, and persistent sinus bradycardia, and sometimes with atrial tachycardia. So the cause of the sick sinus syndrome are fibrosis of the sinus node and coronary heart disease and degeneration. There are so many reasons. So many reasons can cause the sick sinus syndrome. But what is more common is that the coronary heart disease. What about the clinical manifestation of sick sinus syndrome? Most patients are asymptomatic, and some patients may experience syncope, dizziness, and palpitation. Sometimes they have a heart failure or angina, right? Because it has a relationship with the ischemia, the coronary ischemia. What will you do for the sick sinus syndrome on the laboratory examination? The first one, ECG, is most important, right? You can do a 12-lead ECG, a standard ECG for this patient if the patient has a syncope or something. If the patient, if an ECG shows a sick sinus syndrome when a patient has a syncope, we can determine that sinus arrest or sinus bradycardia caused the syncope. So that means the patient should be plant and pacemaker immediately. And the second one is esophageal ECG. Yes, we use some ECG that can do from the esophageal. It can differentiate some difficult sinus arrest or something. And third, Holter recording. Holter recording is a ECG usually can be detected for about 24 hours or even for 48 hours. It can count the total number of the sinus arrest or sinus bradycardia. It is also useful for us to diagnose sick sinus syndrome. And sometimes we use the atropine test. Atropine test, we inject the atropine for a patient, and after 2 to 5 minutes later, and the sinus rhythm usually goes up to 19 beats per minute. If the heart rate is smaller than 90 beats per minute, it means the patient's sinus node is abnormal. And what about the treatment? Drug therapy for the sick sinus syndrome, including atropine, isopranoline, pacemaker implantation. Okay, This is the lesson. It's the second lesson of ECG. In this lesson, we focus about the sinus arrhythmia, including sinus tachycardia, sinus bradycardia, sinus arrest, and most importantly, sick sinus syndrome. So I need you to remember what about the definition of the sick sinus syndrome. What about the manifestations of the sick sinus syndrome? What about the diagnosis criteria of sick sinus syndrome? And finally, what should we do for the sick sinus syndrome? What is the most effective way to treat the sick sinus syndrome? So this knowledge is important. I need you to memorize this knowledge. Okay, we will see later.